It's set to recording. If anyone has an issue with that, message me privately and I'll edit later.
It might also be good, Laurie, if it's Simone again, maybe if we just whack in the chat pod where we're from, what organisations, because I just think each time we're seeing all these names, it's awesome. Yes. And some folks I know quite well, yeah, and other folks I don't. So just, I think that I'd find that helpful, maybe if other people well. So I'm Simone from TAFE, but yeah, would be great to, and I'm just out at Lithgow TAFE.
Wonderful. Well, as it is a small group, how about we do a quick run around the screen and just do a quick intro. So, Ian, how about you start? Because you were the brainchild behind today, and I think it's a really great initiative. So let's kick off with Ian, just a quick intro and why we're doing what we're doing today.
Okay, thanks, Laurie. I'm Rocky from Boomerang Adventures. I'm the owner of Boomerang Adventures, and obviously this has hit us all pretty hard. So it's fairly important, I think, to get together to discuss these things. I think that the bottom line for us all is if something goes wrong, if there's a transmission between a student and a student, or a student and a teacher, a student and one of our staff on any program in the next 6 months or whenever it might be, will probably be shut down until there's a vaccine, and probably to 2022. It doesn't matter what company it is, how professional, how unprofessional, how big, how small. If something does go wrong on a program, we'll be shut down. So I guess that's one of the reasons I think it's important for us to band together and really have a very united and solid front, professional front, and cover as many bases as we possibly can. My feeling about today was just to sort of get a bit of a discussion around 4 main areas of risk assessment. The first being screening, obviously keeping students away from our programs that may have symptoms is going to be the first thing. So how do we manage the screening of students? The actual activities, I think that would, in my mind, would have taken the most discussion, just to actually work through the different activities and look at the ways that we're dealing with those things, and some of the things that we've put in place already in each of our organisations to give us a good picture of what we should be looking for. The action plan is the next part. What do you do when you've got a suspected case on your program? How do you deal with that? What teacher are you going to tell has to go and hang out with that student? Which one of your staff members are you going to get to evacuate that student? That whole action plan is the next step if we do have something. And then finally, the post-program equipment cleaning, that all those 4 areas are areas that we need to look at for our risk assessment to be effective, professional, and doing the job that we want it to do, I guess. So those are 4 things that I think are worth discussing as we put together our plans. Each of those things that we've looked at in quite a bit of detail, and we've run into some roadblocks and difficulties in each area. So they're the sorts of things I thought would be worth discussing.
Perfect, Dean. And I think your first 2 are very much the proactive, and the second 2 are the reactive, if I can contextualise it that way. So that's great. Thank you. I'll continue going around my screen, which is obviously what you guys won't see. But Andrew, did you want to introduce yourself?
Yep. My name's Andrew Boyle. I'm from Corf, essentially, up in Queensland. I also run a company called Coefficient. I'm standing in basically for Dom, so that I suppose in all of these different industry Zoom meetings, that it's good to be able to see what's happening in all the different states, and what the different challenges that I suppose everyone's facing. So that's me.
Thanks, Andrew. And that just reiterates our position as Outdoor Council of Australia. We want to get a holistic picture across the whole nation in all of the challenges and issues, and try to get that support at federal and state level. So it's great to be able to work with all the peak bodies that we have been doing in the last few months while I've been here. I'm sure it happened before I got here, but it's been an exceptional journey. David Chitty.
Hi, I'm at Adventure Guides Australia down in Victoria. I also run Mount Buffalo Ski School. I've been around for 35 odd years, so I've seen all these various crises. I'm looking at my risk management in a range of ways. Firstly, the business risk, the risk to my business from credibility, how do I manage if something goes wrong? The next area is insurance and financial, how do I manage the cost of, say, a close down, and how do I work with my insurers? Legal risk, what if I'm involved in a work, in a legal, someone sues me? Or in a work cover case, a teacher gets COVID and goes to work cover and work cover investigators, to see whether we're compliant. And the last one is the one, I guess, the key one, which is how do we manage all the physical risk of dealing with people in the field. So, but I've just divided it in my own mind up that way. There might be other areas.
Great, thanks. Jeff Proctor.
I wear a number of hats. I'm a freelance operator. I'm also a consultant, and I teach at TAFE both at Holmes Glen and Chisholm. And I'm currently the Industry Development Manager for Snow with Tourism Northeast. So just as a bio, I have run my own adventure company until we were burnt out in 2009. So, yep, that's me in a general term.
You got a few hats on there, Jeff. Is there anyone in particular you're interested in today?
Well, all of them actually revolve around risk management.
Yeah.
One from a teaching point of view for the students, I still teach outdoor rec, but basically paddling, high ropes, low ropes, all the adventure training type areas. So it's a pretty hot topic.
Yeah, fabulous. Thank you so much. Brendan Kerr. Oh, wait, yep. Good. Can't hear you, Brendan. Your microphone doesn't seem to be working there. Do you want to try logging out and coming back in, see if that works? Okay, Helen?
Hi everyone, I'm Helen from Primal Adventures. We run small group wilderness adventures mainly for adults and family groups, and also moving into school holiday programs. So all different parts of Australia, New Zealand and Nepal. So hi to everybody. Thank you.
Thanks, Helen. Troy.
Hey Laurie, hey everyone. And hey Jacob, who's also joining me from Outward Bound today. I could be a familiar face to a few. I'm the Health, Safety and Risk Manager for Outward Bound Australia. It's been a big year between toxic smoke, bushfires and then COVID. But we're operating as a work crew, and we've managed to get a few things done. We haven't emerged for programs yet. David, I enjoyed the abseiling photos. Glad to see that someone's out and about. And I've actually, I've run into a couple of operators while doing my own thing. At the moment, I'm concentrating on re-emergence of commercial programs and also some social distance programs we can do with facilitation and Rocky. I'm also interested in getting Duke of Edinburgh out into the field. I've spent my morning basically talking to WorkSafe in different states and jurisdictions and seeing if there's any fixed reviews or approvals that we need to get our COVID safe plans out there. We are working across, well, we will be working across jurisdictions, being Western Australia, Victoria, New South Wales and ACT. And of course, we were quite, I think, fortunate, and a couple of staff members elected to stay in Western Australia. So we've got a presence there, and we don't have to move staff across borders. But at this point, that's something we're going to have to start thinking about. So I'm really, and one of the reasons that Jacob's joined us today is to really start bolting down our operations plans and the nuts and bolts. As Simone said, people have been doing interesting things around innovation, and we've certainly been throwing around the ideas and bring those down into the nuts and bolts plans, which having a policy is everything, but this virus will show if there's any gaps. So we want to knock out the gaps before we start.
Yeah, well done. No, great. Thanks, Troy. And Jacob, did you want to add to that? Obviously, being from the same organisation.
Hi, everyone. No, I'm literally just a second set of ears at the moment.
Okay, great. Then thanks, Simone, for kicking this off. For those that might have just joined or didn't hear, we're just introducing ourselves around the table and just give us a bit of an insight into why you're so interested to be here today. So I'll jump now. David Gregory.
Thanks, Laurie. I'm from Skeggs Redlands, and so I'm head of Outdoor Ed and also head of Winter School. And so Winter School is our residential program in Jindabyne, which has been cancelled this year due to the current concerns. A lot of my work over the years has been in risk management, in Outdoor Ed, and I've worked at Glengarry and all sorts of places, and really keen to look at the take on this current situation.
Adrian, there you go.
We did have a case of scarlet fever on one of our trips previously, so that was one of the most infectious diseases. And we had an outbreak of chickenpox on our winter school program at one point as well. So, yeah, infectious disease is certainly part of the things that we've looked at and considered over the years. And this is yet another one that I'm really keen to hear everyone else's perspective on. And we're keen to get back with our groups back out into the field as well from a school's point of view. We want to get back out as soon as we can.
Yeah, awesome. No, thanks, David. That's really good. Timely that I'll jump to Greg now. Greg Shalon. Go for it.
So I work with Affinity Insurance Brokers. We've been doing insurance for the outdoor industry for 15 or 20 years now. Work very closely with the underwriters and a number of the businesses in here. So I guess just trying to see where you guys are at as an industry. My personal background, I've been involved in Christian youth camping since I was 10, then jumped onto voluntary staff in a CCI camp down in Victoria called Mill Valley Ranch when I was 15. I'm a qualified trail riding guide, and now I'm a ski patroller on the weekends as well. So I'm heavily involved in the industry and have a passion for the industry, and that's how I ended up in the insurance seat at the moment, to be able to try and influence and help the industry from a different perspective and be able to support you guys and actually have someone that knows the industry, knows what you do, to be able to help you out and work out how we have a sustainable industry in the long term.
Beautiful. Thanks, Greg. Well said. Cameron.
G'day. Cameron from Equipped Outdoors. So an equipment supply company. We also have a first aid.
Can't quite hear you, Cameron. Maybe just speak close to the mic or turn it up a little.
Okay. How's that?
Perfect.
Okay. And also an outdoor specific first aid business. I guess one thing I don't think has been mentioned so far is of interest to me is the different arrangements that camps and different accommodation types for sleeping arrangements, because that seems really different across the states. And obviously for dormitory or tent-based accommodation. Yeah, so that's me.
Great. Thank you, Cameron. That's good. Jacob. I haven't. Oh, no, I've done you, Jacob. Sorry. I'm going down two different lists here. Sorry. Jenny Reese.
Hi. You don't normally get my face, but there's two uni students around behind me as well, so we're juggling.
No problem.
I do Duke of Edinburgh Award at Oxley College at Barradoo, and I go out with Brendan lots and lots. So I trust him to keep us safe. And I'm also a scout leader at Mittagong, and I do safety at jamborees and coveries and first aid for caving and abseiling in our local region. So,
fabulous. Thanks, Jenny.
So yeah, risk is a little bit of an issue for me.
Yeah, no, fair enough. Okay, all good. Philip.
Yeah, g'day. I'm Phil. Work at YouthWorks Christian Outdoor Education, and I'm the training manager there. So my interest in today is looking at probably similar to Simone in that how we look to re-engage training our staff, over the next coming months.
Fabulous. Great. Caleb.
Yeah, hi, it's Mick and Caleb from and Genevieve from Camp Somerset. Yes, we are socially distancing in the office here.
Good to hear.
I've been on 2 months leave, so you probably don't want to see my head at the moment. I've had to save on razors. Look, really interested in joining the group just to find out, how everyone is. A bit like what Rocky said, the risk of managing and running activities. The post-program stuff, which I know Cam has from Equipped has touched a little bit on, the cleaning and also the sleeping arrangements. I know we all from industry got a bit of information the other day from Wilderness Equipment, which was handy. And I guess the importance of something like today is ensuring that industry that we're being consistent across the areas.
Yeah.
So that, schools are going to talk and make sure that we're all doing that. And yeah, I guess like most in industry, we're hoping to be up and running for some Duke of Ed programs in mid-July. So yeah, we had a meeting this morning about all those sort of things about parent drop-offs, parent pickups, and as we know, parents can be hard to keep in their cars and keep going. So we've got to sort of manage that sort of stuff as well, I guess. So yeah, hello to everyone.
Great. Thank you. Thanks for joining. Mark Arundel.
Sorry, I've just been kind of setting up. I've just come out on this late. So you just want to get a bit of an overview on what we're doing and why we're here today?
Just introducing yourself and your business and why you're here today.
Okay, so we run Mulga Bicycle Tours. We're based in Canberra. We run tours across New South Wales, ACT, Victoria, South Australia and Queensland. And why we're here today, we've always, since us starting 3 years ago, very much into risk management. Found that it's a bit of self-taught, although we engaged another company to help us, and just wanted to pick up on how people go with risk management in this new COVID times.
Brilliant. Thank you. Michael Alton? Need help? Yeah.
Hey, so Michael Alton from the Colliery Centre. Just looking at whole side of risk stuff. We've actually got some Duke of Ed hikes going out in 2 weeks, and then we also run birthday parties, and we have 3 or 4 booked for this weekend. So it's sort of going to be the first test of running some activities. We're sort of centre based, and then also the Duke of Ed offsite. So we can contain the site a little bit better and manage that, but obviously getting a bit of an understanding about what everyone is doing in terms of like their cleaning process or quarantine process and stuff like that. Very interested in what everyone else has got. And happy to share a whole heap of stuff I've been rattling through.
Wonderful. Thanks, Michael. Patrick.
In what everyone's comments are. I wrote a book titled White Sherpas back in November 2013, which was about the Everest 1988 ventures. The key aspect that I'm adding to a second edition is the risk of not taking a risk. Everest was run prior to the OHS Act 1991, prior to mandatory risk management plans and the internet and all the rest of it. And I've come to the conclusion that the biggest safety we have is in detailed planning before the activity takes place. And if you have detailed planning, that incorporates risk management. And if you do that, you can just focus on key risks. So that's my interest.
Brilliant. Thanks, Patrick. Very different to everyone else. Good to see. Yep. Sam.
Yep, I'm here with Phil, Christian Outdoor Education YouthWorks. Interested in thinking about our existing risk management, thinking about screening, cleaning, and social distancing. Particularly today, I'm getting stumped on emergency practices. How do we evacuate, first aid? How do we do a recovery in high ropes? Yeah, that's where I'm at today.
Okay, great. Thank you. Warren.
I'm the Outdoor Ed manager at Tallong Outdoor Education Centre in the Southern Highlands. We're a campus of Santa Sabina College in Sydney. We run their sequential outdoor ed program, but we also run programs for other schools, public and private, and we also open up the centre for other providers to bring their programs to the centre as well. So we've got a whole bunch of different issues that we need to look at, stuff that we can do internally through the school, but the services that we provide to other people as well. So yeah, obviously there's the issues of how do we facilitate the accommodation, the staying in the dormitories? How do we organise the restaurant, the dining room facilities? The other issues around, excuse me.
Oh, he blew his microphone. Just muted. Okay, can't hear you anymore, Warren. No, can anyone hear Warren, or is it just me? No, can't hear you. Okay, so, all right, well, I think we got the gist of that while you're trying to fix your microphone. Now I've got a few missing. Brendan, did you come back?
Can you hear me, Laurie?
Yay, we can hear you.
Hey, I'm Brendan. I'm from the Land's Edge Foundation, just here in Barrie, New South Wales. I run the safety management system and also risk management for the foundation, as well as program coordination and a bit in the field. So really just coming in and looking today, sort of what everyone's obviously doing in the industry, comparing some of our planning and our safety management around COVID-19 already, and just trying to get a holistic image of it all, really echoing the sentiment of sort of everyone who's
going. Everyone else, yeah. Okay, great. Thank you. We've got 2 left, I think, unless I miscounted. So, Viv?
Good morning. I'm Viv. Yeah, thanks for having me. I'm from the Colorado Center. I also work at Wesley Vision Valley and Nepean Adventure Center down south. Yeah, so the reason why I like to come for these sessions is I actually wrote it down just so that I don't forget it. A passion and obsession with the industry, just keeping up to date, and yeah, just learning more. I have a lot of conversations with Michael Orton.
Yeah,
awesome. Hi, Mikey.
Wonderful, good on you. That's fabulous.
Thanks for having me as well.
Thank you. Thanks for coming. And last, but lucky not least, is Anna.
Hey, folks. I don't have my camera up because my laptop's down. But I work at Jindabyne Sport and Rec for Office of Sport. So we've got 11 centres in New South Wales. Well, 10 centres, sorry, in New South Wales now that run mainly hardtop programs. So I'm just interested in the conversation about all the on-site stuff that people have talked about already, like accommodation and dining hall, but a couple of things of interest at the start that I think Simone raised and someone else, I can't remember, about first aid and doing rescues as well in certain activities. So just interested in part of the industry conversation about that, about what everyone else is thinking about those kind of on-site activities as well as off. And on the flip side of that, we also do ski program here in winter. So not sure if anybody within the meeting is running any ski program for schools or anyone else this season, but just interested in thoughts about where people are going with that. We've effectively cancelled our school ones up until mid-August on some advice from Perisher, but after that potentially we will be back out there. So just interested from a risk point of view if anyone has anything to add about thoughts about being out in community with groups and quite close quarters, I guess, with lots of community members up there on the snow.
Great, thanks Anna. Have I missed anyone? And I can't count. No, I can count. Great. All right. Just there is a lot here than what you guys have just said. So I think we're going to be a bit ambitious on a now a 1.5 hour time frame to try to knock over this. But I'm conscious that most of you talked around rescues and reactionary risk. So how do people feel if we sort of jump to that straight away? Have anyone else got a thought? Yep, I'm getting some thumbs up. So great. Who would like to start on their issues, or even some things that they've been doing in that area, in rescue, and particularly the first aid issue that even Anna just raised?
I'm the oldest here and the noisiest, so I'm happy to start.
Go for it, David.
Okay. To me, a first aid incident or a rescue of any type just simply takes over from your normal social distancing. It takes priority over everything else. So whoever has to conduct the rescue goes in and conducts the rescue as normal, because otherwise if you try and change things, you probably increase the risk. I think we then we treat it as an incident, even if it's a minor rescue, perhaps report it to the land manager, to our insurer, to WorkSafe, or whatever you would normally report an incident to. We would then have a mandatory, watch people and watch the issue for 14 days, 28 days, whatever you wish to do. And after a certain period of time, it's not an issue. There will always be accidental, contacts and stuff anyway. I think the simplest way with rescues is just do them and report them as an incident.
Yep. I absolutely agree with David. Troy Dare here with Outward Bound Australia. We're putting people into a situation where a rescue or first aid is required, and you guys already know my thoughts on. Look, we do gold standard first aid, not just compression only CPR. So yes, rescues need to be done. I've been managing a team of 12 first aiders during the period as well, and we've had to do a couple of responses, including for seizures, that sort of thing, and also some head injuries. What I sought to do straight up is actually compartmentalise a rescue. That is, right, that's happening there, everyone else moves away, and that site, consider it a taped off site. It's not going active again for a workplace in the environments that we've been working until it's actually been cleaned. So there's disinfectant around and there's someone actually actively cleaning that. By compartmentalising the rescue, you're forced to think ahead of what is required, what may be required for a rescue or a first aid incident, which means you're planning. Nod to Patrick there, and then can actually compartmentalise those people, that scene, which is managed well, but is then taken out of the bigger context of the activity or the group. And from that, you can strip out what you need. Okay, who needs to be isolated? What needs to be followed up and tested? What contacts have been made? So for me, compartmentalisation actually means you're not impacting your overall business or group activity with the compartmentalised rescue or first aid situation. Cheers.
Cool. Has anyone else got any more thoughts on that, or are they quite satisfied with what they've heard? Questions?
So this has been a big thing that we're working through within the resorts and ski patrolling at the moment. There's been a lot of planning and back and forth on this. So some of the procedures that we've worked on, and number one in first aid is D for danger, and it's danger to the first aider. So to consider what sort of extra PPE, especially say in those CPR situations where there is the potential for the aerosolization of particles and things like that during compressions, having the appropriate PPE for the rescuers during that time. So to give you an idea, some of the stuff that we were looking at in addition to our normal first aid kit, when we were going to have to respond to incidents, was 3 surgical masks, some P2 or N95 face masks. Because one thing as well, you can put, depending on the incident, and let's say you've got a upper body laceration and you are having to get up and close, you actually put a mask on the patient or the casualty as well. Having appropriate safety glasses, supplies of medical gloves, surgical gowns as well, because once a patient has been treated, you do have to consider all of the outdoor gear that the first aider is wearing is now considered hot and has to be disposed of or cleaned, which with our, I don't know about you, my Gore-Tex jackets are quite expensive and I would like a bit of protection on them. And just also things like space sheets and hand sanitizer, and that was, and a waste bag. So that was what we were looking at as an additional kit. From a procedure perspective, because the way we respond to an incident, we'll have a patrol vest on that has all our gear. Now, often when you're treating a casualty, you're having to go in and out and grab things. What we've spoken about as a procedure to maintain that that vest in its sterile state is you respond to a casualty with 2 people. You remove your vest, you hand that to the second patroller, and then you request gear and equipment from them. So they go into your vest, remove that, hand that to you, so you're not infecting your own gear. So then it's a much quicker process to get across. So that's just some of the things that we've been thinking about in how we respond to incidences relation to these things. Now, you guys are in a much better situation that most of the time you're going to have a bit more time and contact with your participants, where we're coming in with an unknown background on them.
Viv, can I just ask a question on the surgical versus N95 masks? Did you have a look at anything around the comments that an N95 mask being a one-way valve actually, with someone that's breathing hard, is actually causing a spray from the valve? Did you see?
I haven't seen those specific things. This is actually these requirements that come down from ASPR and those the national bodies in regards to that. But I haven't looked into those individual specifics of that.
No worries. Just asking. I was just
no, that's an interesting one. I'll have a look into that because that does interest me as well.
Do you have any insight into that, knowing what you do?
Hopefully you can hear me this time.
Yes.
Yeah, there is, all I can add is there is some grading from civilian mask through to surgical mask, as opposed to they are obviously more designed for control rather than removing debris and smoke inhalation and so forth. So maybe the surgical mask avenue is a better way to go, but no, nothing definitive.
Mm-hmm. Thank you.
And the way we're looking at it is, and we all know that there is no way to completely remove risk, and like Patrick was saying earlier, we do have to have an element of risk in the activities we do, because that's what makes them fun. And from an insurance point of view, we don't want things not to have risk, because that's where the enjoyment comes from. But when we look at all these things, what we're trying to do is manage the risk. And if we do get a work cover investigation, like Dave said, if we are standing in front of the coroner, if we are standing in front of a judge, we can say we made our best effort to reduce the risk and manage the risk. But there is still inherent risk to these things. And I think if we have a good procedure, we're all going to be happy enough to stand up and say, we gave it our best shot.
And each of the work safe authorities is always operating to what is reasonable and practicable. And in this case, they've actually got a bit of they're not going to let people out to play unless it's practicable and they consider it safe. So they've actually got a little bit more in their back pocket in terms of, hey, you're not getting out there unless you can demonstrate it. And that's why we're looking to have these COVID safe plans and those really transparent nuts and bolts in place.
It's Simone here. Thanks, Troy and Greg, so far. I just wanted to see, was there a general consensus then with regards to treatment of first aid where you can't maintain social distancing? that people are both using the surgical mask from both the first aider and the person who's receiving first aid?
Yes, Simone. I've been recommending in the kits, it's 3 surgical masks. That way you can have a CPR person, compression person, a mouth person. That is, I've been advocating use of BVM masks, and also a mask for the patient. We've got to be careful that we don't actually occlude an airway with a mask of any type, because that's what we're trying to re-establish and maintain patency. But also glasses for anyone particularly working around the head, which actually means both CPR people, because we are pressing on the chest and we are generating aerosols. So we're talking safety glasses for both first aiders. And that apron is, as the guys were saying, is quite necessary, because our outdoor gear, our jackets, that's actually keeping us safe. And if we've then got to get rid of them, that's actually not looking to the danger for first aider. Gloves, also quite a number of pairs available, and with no need to double glove, but certainly have a second set of gloves. And what was it, Jacob? One-way traffic on the first aid kit. Even if you're pointing to a first aid kit and a bystander and saying that white thing with the red thing on it, pass it here, then you're actually getting that one-way traffic.
Yeah, great.
I'm most interested today in protocols around. We need to ensure that we do have protocols in place that if we have to support someone out of a field, that we are looking to the safety of staff, the patient, and also the timely evacuation of that patient. Because simply calling an ambulance and handballing to them, it's probably not enough for our risk management. We want to be able to transport safely. So I was speaking to WorkSafe for a couple of states this morning around what they're going to allow for people being transported in a vehicle for first aid or care purposes. And that could mean masks inside vehicles for everyone, including the driver, and slots with our already augmented procedures around daily vehicle cleaning and pre and post trip wipe downs and that sort of thing.
Yeah, great. Thank you.
I think that activity rescues where there isn't an injury, there's no blood or broken bones, are a separate issue to your first aid, and a much simpler thing to handle. You just handle them as a normal and record all, as I said, and record and report, and watch.
Having been out and about on the cliffs, Dave, with a few clients, what are you seeing in terms of people able to social distance? I noticed you're using the pigskin gloves and that sort of thing. What are you finding is working for activities, and what are the complications you've seen?
Okay, we're only running small groups, and we've had a range. With little children, I had a family with 5 to 9-year-olds abseiling, and they just all bunched together. Social distancing is impossible at that level. With the older teenagers and adults, we got them to rig we issued them with gear that was their gear. They rigged their own figure eights. We taught them how to tie a rethreaded figure eight for their own descenders. They rigged. We taught them how to tie a rethreaded figure eight. We had some other systems, and we started the abseil with the belayer, the instructor, well away. A couple of meters away. We've marked. We've got ropes and we measure things out, and then you can move into the top of the abseil. Gloves and all the rest of the stuff, we're just quarantining it, for a long period, avoiding trying to use chemicals and other dodgy stuff. When we've got school groups, we're going to have to look at how we manage that. We may have to start looking cleaning, but I've got enough gear with smaller groups to just keep on changing it over on a weekly basis, for instance.
And I'm just going to throw that in there, Dave. I think it's great that you're able to do those different skills with those participants, because it's one thing anyone that's had a chat to me about. I'm really about skill development in the industry rather than just a straight guided put them on the merry-go-round and send them around, but actually developing people so that they learn and want to come back in the outdoors. So I think it's a great thing that this has led to an even better offering for the participant as well.
and I might add that with the different groups, with the small kids groups, I made sure that the instructors were young and healthy, as healthy as I can imagine, rather than say an older person. I've got some older instructors who, because the kids struggle with social distancing, so it's less of an issue with, say, a younger instructor possibly, if something gets transmitted, than it is with people in their 60s, which I have a number of.
Yeah, I've also been struggling with, wrestling with, okay, how do we be fair to instructors and our staff? Because we've got a responsibility to work health and safety in the COVID context as well, and looking at who has what risks, and also talked about establishing basically an exposure bank. How many customer contacts or random person contacts is fair to a particular instructor before rotating out to another instructor? Because whatever self-isolation that someone might have to do after an exposure is a risk that they're taking for their workplace, but should be a fair risk also. So we started wrestling with that and what's fair to staff as well.
Troy, just quickly, Sam's just asked what the class of mask you mentioned was, the one you were recommending.
Yeah, look, obviously the N95 masks are a good mask. They won't work for beards, and also I want to minimise the use of masks, so social distancing all the way, but in a vehicle or in the first aid situation, it's going to have to be surgical masks. Now, don't just buy it and think that it's going to be there. A surgical mask has a couple of ties. You've got to know how to do it. And really what I'm looking to drill our instructors in is that our first aid response to a CPR necessity only adds 6 to 8 seconds for a response. I want to be that gold standard because I don't want COVID to be taking away from what we can offer participants in terms of safety. So we will be drilling that, and I've also spoken to Cameron and others and sourced a pocket BVM, which just slips into the top of a rucksack. Cameron can probably speak more to those, but Cameron, thank you very much. I've got one, and I'm going to want some more, mate. Sorry. Specifically, Sam, go the surgical masks, and I'm sure that Jacob, in his conversations with me, has also just said, look, having something which can be in a shirt pocket or a vest pocket. So having your safety glasses, your surgical mask, and your gloves right there means you can be instantly amenable to that first aid situation. An N95 mask is quite a molded big thing. They can be deformed, and they also take up a fair bit of space. So surgical mask, practice putting it on so you can do so fast. Mask goes on, glove goes on, glasses go on.
And I'll throw a link up in the chat as well. One of the things that that I use a lot and we use a lot in the Ski Patrol is the Ambulance Victoria Clinical Practice Guidelines. Most of their CPGs are actually available to the public. I'm not sure if New South Wales have done that, but it has your treatment algorithms and a lot of things like that. They've got some specific COVID allowances and CPGs there as well. So it's definitely a really good resource to have a look at when you are planning and for staff training, etc.
Thanks, Greg. Yeah, throw it up. I'll include in the notes as well.
I would like to perhaps just suggest that there's a couple of things with regard to a general incident, a COVID incident, and training. So a lot of the solutions that we've talked about, the use of BVMs and whatever, are really possible from a training point of view. I don't think there's really a great deal of issues with first aid training and even training in a more general situation. If you've got an incident where somebody's busted their leg and you can't be assured that they're COVID free, yes, obviously taking some precaution, but the wording I believe is that you should take these precautions wherever possible. And if they can make it exceptions for people to jump in elevators together to get to their office, I don't think we should be too worried about, having two people in a car. right up until they're COVID positive, of course. But, you know, I think we really are being very, very careful here. Where, you know, in the vast majority of, I don't know, football stadiums that you can now go to, I can assure you there's, you know, there's a lot less care or a lot less precaution being taken, given, you know, with regard to a specific injury or an incident like this.
Mm.
Yeah, I guess for me, Cameron, it really is about preserving our staff's health and safety, and also our capacity to operate as a business, because there are reputational risks, but there's also capacity risks. And look, I think we've just got to be fair to our staff and say, hey, look, let's operate very carefully. Let's do all that we can for ourselves and our clients. And that way, you know, every person that we're working with, we're actually tying ourselves to that person for 2 weeks. And that was something I was careful to note early in the piece, that, you know, I meet you today and I'm affected by you for the next 2 weeks. Now that's something you can certainly tie into the community factor, the community aspect, but it's also a reality is that someone can be, you know, very careful today and then not so careful about something in 2 days' time, and I'm affected and have to self-isolate because I was a contact within the 5 days and that sort of thing. So it's I think we do all that we can, and cross our fingers and hope that we don't get affected by something else. But I think there'll be certainly places that where clusters break out, that people get locked down and it seems unfair. But again, from the beginning, I've been advocating that people keep a places and times diary, so that you know that you weren't at that supermarket after 2 o'clock when that COVID case was there. It just means that you can keep your staff logistics planning tight. You can diarise events, that sort of thing, and you can prove that you weren't, even if you then have to go into isolation. With badge of honour, everyone else that was there was actually COVID positive because they didn't take these precautions. Hey, look at that, our staff member didn't get it. How good is that? Good on him.
Mm. Yeah, and to your point, Troy, I think David mentioned it perfectly at the beginning, where there's the 4 different types of risk. You know, I've just written it down: the business reputational risk, the insurance financial risk, the legal risk, and the work cover risk. So assessing that across all aspects.
And to that, Laurie, and particularly David, I guess you probably, if you're the guy that I think I know, you probably have. Have you spoken specifically to your insurer about re-emergence and in the COVID context, and how that affects, or have they mentioned any increased premiums or excesses, that sort of thing?
I'm seeing Greg smile tremendously right now.
You better Dave, have you asked your insurer? David, you might need to ask your insurer about that. So what we're seeing is it's still really an unknown factor. And this is some of the stuff we've been talking to Laurie and the different state bodies about. Right now, from where we're sitting, COVID is actually not the biggest issue that we've got in regards to risk management and insurance and the continuation to provide insurance. There's a lot of claims and a lot of incidences. There's been 4 or 5 insurers that have pulled out of the market recently. There's a lot worse things to consider than the risk of a COVID claim.
The reason I asked, Greg, is in actually pursuing and looking through our bushfire insurance claims, we have excesses so we've got insurance for business continuity for if we get restricted for access to areas in which we operate after 48 hours. And so you've got that 48-hour excess. But of course, if our workplace is locked down for 2 weeks for deep cleaning and COVID isolation, then that becomes actually, well, technically under our insurance policy, that becomes claimable for 12 days. So I was wondering whether that had been topical in the insurance industry, and David's usually pretty good with the fine print.
Yeah, and I think that the reason that those specific things from the business interruption point of view haven't been discussed too much within the outdoor industry, you're probably one of the few operations that would have a business continuity insurance. A lot of outdoor operators are, as you know, on the smaller end of things, and probably don't have the funds to have a full business interruption coverage. So what I was talking about was specific to the public liability side. But as we see, like, a lot of people don't really have a full business interruption, and I haven't done a lot of research into that specific class. So I'm more than happy to have a chat after, but you may see, if not premium increases specific to that, there may be specific clauses come onto policies or adjustment in wordings on the renewal of those policies.
Thank you, Greg. Look, throw an email or something into the chat if you like, or hit me up. That'd be great. And I just wanted to flag it as something which, you know, people may not have considered, but might be within their scope at the moment. Thanks, guys.
Mark, did you want to talk to your question you just threw up?
Yeah, I'm just saying, I'm talking to myself with the microphone mute, just wondering why nothing is happening. Yeah, I don't understand the need for deep cleaning and talking about isolating for 14 days when the advice is quarantine. You can quarantine something for 3 days. So therefore, why don't we just lock down a building for 3 days, then just go in and do a general clean and open it up 3 days later? Where's the 14-day coming down and requirement?
Mike, I'm just interested in where the 3-day timeline there's coming from.
Yeah, the advice, the Chief Medical Officer of Australia has actually turned around and said that 72 hours is the only time, is how long the virus is viable for.
Can I just say something to that?
Yeah.
Yeah, so I guess in a position, because I've been tossing up between the cleaning, as you said, and the quarantine. And for our situation is we won't have enough gear to get through enough participants at a certain time. So there might be a quicker turnover.
Right, yeah. Well, no, it's more if you had a case that you... And
just with that one, I think, Laurie, it might be worth chasing up, because I think they're two separate issues. I think the building or the site will only have to be quarantined and cleaned, or cleaned and or quarantined if a COVID outbreak for a much shorter period of time. And you may be able to put another set of staff in. I think that's probably the way it is. And then, but the existing staff that were involved, plus the participants, they're the ones that are going to have to quarantine. That's the way I read it. The site and the buildings are a cleaning and a much different issue.
My concern about it is, in doing a clean, you're exposing yourself to a hazard that you know that's there. If all we do is just have to wait for 3 days, that hazard's gone.
Yeah, I haven't got specifics. I've got a recommended cleaning plan for commercial cleaners for the COVID context. But as soon as I started seeing that schools were closing for 2 and 3 days for a deep clean, I figured, okay, well, they're going to have a specific plan. But in the past, or in the run up to now, there was a lot of information around different viability timelines for virus on different surfaces. So I'd be very interested in establishing that, because, yeah, as you say, Mark, the tighter we can tie it down, we can give that specific timeline, give it another half a day, and get back into facilities, that sort of thing. So very interested in that one. Anyone that is looking into that.
Can I just share there are quite a few guidelines already out there, and there's one for accommodation houses that the DHS has put out as a recommended process for cleaning, and we're talking about bed and breakfast or any other type of accommodation. So the process itself should be no different for a camp than it is for any other accommodation centre. So I can put those guidelines, I can send them through to Laurie if you want them,
Yeah.
They're things that we've been sending out to the industries that I deal with.
Great. No, that's great. Jeff, if you want to throw them into the chat for everyone, I'll also put them in the notes.
Will do.
Thank you. Great. Anything else anyone wants to speak on this particular area? Going back to what Ian started with, which is phase 1 of risk management screening, phase 2 activities, phase 3 action plan, phase 4 post event. We're still in that action plan scenario from what I'm hearing, with a bit of post event. We're sort of going into the post event scenario. So if we're happy to continue on this way, or
I'll just put one point in there for so I think people are talking about high ropes rescues. I sort of looked at the surf lifesaving, how they do the talk, reach, throw thing prior. So for more specific for our high ropes course, we're able to identify certain elements that are the ones where have most rescues. And we've put in some assistance, say, so like a rope where the person can possibly pull themselves along a little bit easier to help them. So we're not doing that contact rescue. Or even on a lower part, there might be some other sort of assistance that we're trying to do. So not having that, leaving that contact rescue to the last possible sort of moment.
has anyone done any work in that space that Michael's talking to?
We've just been practicing all of our staff on a whole range of rescue scenarios so that and then simplifying the way we do things. And we have precluded running some locations or activities because the rescue might be more complex than we're happy. We downgrade it to something in a simpler area, for instance. So I think we've got to change the way we operate. Sometimes it might be smaller groups, longer period of time, where a 2-hour block extended to 3 hours so that you can do more work in teaching people how to do things themselves. I think we've got to be think outside the box for a change.
Like working from home, maybe.
Yeah, one of the considerations that I'm talking to the people that I'm teaching high ropes at the moment is to change the structure so everything is a ground belay, so rescues become a lower rather than a climb and rescue. I know it means that we operate differently, but it's one way of eliminating a rescue potential, and especially if you've got particular activities that have a tendency to have a rescue required. So that maybe that's a thought, but something that we're talking about as a training aspect at this point.
Mm-hmm.
I'd like to speak, I did answer, I'd like to speak to Warren's comment about managing Flying Fox where PAX and leader are very close to each other. I did make a comment there. I don't think we can run anything inside the 1.5 metres, regardless of PPE. I think 1.5 metres and 4 square metres are the rule. I think they're the rule for all activities. If we can't run an activity with our leaders and staff, in the right social distance, we probably can't run that activity.
Yeah, and that goes to reputational as well. It's hey, what were they even doing out there doing that sort of thing? I'm locked down here at home. Why did they get to do that? And look what they've done. They've just created a cluster. So it is reputational there as well. But for me, there's been some activities where I've just gone, we're not doing that until we get the opportunity within social distancing and practical application of that. So concentrating on bushwalking, on paddling, that sort of thing, and what can be done in that, and then compartmentalising.
Just one point. I noticed that if you go to the dentist or the doctor, when you walk into the surgery, they do a temperature check on your forehead, and then they ask you to use a sanitizer. And before all that, they ask, are you healthy? do you have the flu or anything like that? And if there's a tick in the box to all of those, then they proceed. As a dentist, for example, they're operating within inches of yourself, or I had cataract surgery, so the doctors and nurses are all giving eye drops, and some of them have masks, some of them have not. But the key from what I can see is that they've assured themselves with the temperature check, hand sanitizer, and you're saying that you're healthy, that the risk of something going wrong virus-wise is very low. And maybe the same can apply in adventure.
Well, there is that. So I've been working in a workplace where we've got gaffer tape on the floors. Everyone's 1.5 distance apart. We've got 4 square meters per person, but we still do have to pass by each other. So I get a shot between the eyes with the thermometer on the way in. We do have to declare any respiratory illness, but we've also got to be living with that. If we've been working in small teams, and if someone in that team is diagnosed COVID positive, the entire team must go self-isolate. But also, given the architecture of a workplace, also the other team next to them must self-isolate. Now that scrolls down into a lower protocol if someone in the workplace is known to be a close contact of someone outside the workplace who has been diagnosed with COVID-19. In that case, just the team of 4 is required to go and self-isolate. But there are ripple effects to that. When we get into these bigger groups that we are using to be commercially viable, we're tying ourselves to a lot of people. So the more precautions we can put in place, the less we have to accept that assurance that it's all good, temperature's low, and within that, the dental surgery would be listed as somewhere that they have been in their week previous. So the other clients and the staff of the dental surgery would be affected by that and contact traced by the government. So that assurance is nice, but comes to nothing if the government just says, hey, you've got to self-isolate because you were close contacts. So we do what we can do with precautions, and assurances are nice on top of that.
I might add that one dentist and one patient is different to 40 or 50 staff and a couple of hundred kids at one of the bigger school camps, plus the transport company, plus whoever else has been in there. You could talk, an effect of 200 or 300 people out of one case in a big camp environment.
Yeah, I might jump in there on that. We had a case, as I mentioned before, we had a case of scarlet fever, which is also extremely quickly. One of the challenges from, say, an educational point of view is the perception of risk is one. There are actual risks, and it's not saying there's no actual risk with this, but I think the perception of risk is one thing that we really do need to deal with as an industry, and the messaging that we're going to be able to provide our parents for the schools to say, okay, how are we running this to minimise the risk? Because I think this has added a really big extra layer anyway, and we probably should, to manage infectious diseases. But because this is so front and centre to everyone's minds, how are we going to message, how are we going to approach to ensure that we do get the groups back out and we do get them out confidently, and then also our dealing with, and it's been really interesting hearing about the compartmentalised. So just thoughts and ideas on that messaging on the perceived risk for our clients, and so certainly something I want to take to my parents as well.
I think we've got the general gist there. Is it my internet or is it David's? Did everyone get everything?
It's breaking up a little, but got the good gist of that. David, I think that what we're going to see more of is contact with a specialist within the school, particularly the larger schools. I've seen it for the last couple of years anyway, around the compliance officer wanting to be in contact with external providers. And that compliance officer now entering their vocabulary will, of course, be the COVID safe plan or the protocols for and around transport of someone with suspected symptoms, that sort of thing. So I think we need to be really upfront and have it in black and white what gets done when, and that's why that COVID safe plan and documentation is so important. There's going to be a different conversation with a new person being the compliance officer instead of just the vice principal, for instance.
I think too, just on that front, David, in terms of communicating the risk, I think one of the things that is quite obvious even if you look at the health.gov stats for COVID-19 at the moment, that the transmission rate and cases, etc., with school-aged children is significantly smaller than it is in the next sort of population up, between in the 29s to 39s is where the bulk of the infections come from. My sort of view is that what we really should be looking at is more what's happening with our staff and making sure that our staff are well and truly on board with self-isolating themselves until they get tested, more so than looking at what's happening with the students, because currently in Australia they haven't actually had a case where it's gone from student to adult. It's been more adult to student. So that was the last bit of information that I've seen.
Thanks, Andrew. Yeah, that's what I've read too. But it did stop a Bulldogs game this week. Anyone else want to jump in? Great, David, did that sort of answer, David Gregory, did that help?
Yeah, I'll just flick something in the chat since my internet was breaking up. So I'll just flick something there. Yep.
Right.
Thank you.
Wonderful, thank you. Okay, I'm trying to keep as many notes as I can, very crudely. It needs a lot of editing. Anything we want to jump to now? Obviously, we're definitely into the post-event sort of scenario, I think, now.
Laurie, I might just have a quick chat on that. Obviously, most of the discussion at the moment has been related to dealing with situations and incidents in the light of, trying to protect ourselves and the clients. I'm wondering, with our action plans, if people have thought much about what will happen if you have a suspected case on your program, because I think that's the next level. That's a very big question, I suppose, and that's one of the areas where we've sort of looked at that many different scenarios in how to manage that properly. So maybe we could open that up in terms of where we go.
Sounds good, Ian.
Yeah, so, sorry.
Oh, go for it, Rocky. It's Simone. I just wanted to add into that, but you keep going.
Yeah, okay. I'll just quickly look at some of the things we've been looking at. Obviously, the first thing is, when do you determine a suspected case? I mean, we're not going to be shutting things down for a cough or a sniffle, so it's a difficult situation to work out when you are going to look at, the possibility of getting a student out of a program, and therefore, every other student involved in that group or the whole group itself. And then how you manage that, which staff member from the school are they allocated to be the person that will go with that evacuation, which one of your staff members. That comes back to the PPE and the management of that in terms of how you go about it. But it's a big question, it's a big if, and I know some of our schools have sort of asked, am I the staff member who's going to have to deal with that if that's the situation? I'm a little bit older or whatever it might be. because they're the Duke of Ed coordinator, or they're the sort of camp director from the school's point of view. So just, I guess, yeah, trying to open up that discussion on people's planning when we may have a suspected case on a program.
I think that a suspected case you might decide to isolate with a teacher or send to get tested, but you can't assume you've got a case until you've got a medical diagnosis, for instance. And then the medical system moves into checking you out, and whoever else comes in officially. Other than that, every time someone's got a cough over winter, we're going to be closing our systems down. There aren't that many cases. So I think it's got to be a medical diagnosis.
I started working from the consequences end of things, of what happens if I sent someone from a program either without being tested or pending a diagnosis and spreading it out. So I started working back to what's the critical timeline from someone looking like they need to be tested to getting a positive or negative test back, and what has to happen between that time. So what I came to from that was, if I've got a program in the field for 4 days, then I've got to have made the decision to have observed, monitored, and sent someone to testing before the end of 24 hours out from the end of that program. Otherwise, I'm impacting everyone else on that program, parents, schools, that sort of thing. But then I've also got to cover that last day by thinking, well, okay, it may be that a program has to be extended by 24 hours. That is, that we may have to accommodate a group or an individual on site for an extra 24 hours to allow that test to come back. So there's ramifications the closer you are to the end of a program, but working back from that during the program, then yes, you can screen before the program. Thermometers, can be available in the field, but closer to the end of the program, the more complicated it gets for how big this goes after the program. That was just my logic for working backwards rather than from the start.
Can I also jump in there as well? For us at TAFE, it's really quite different because we're working with adults. So we're at one end of extremely concerned, to the point where I can't even be in a vehicle with anyone else. So in terms of escorting somebody out to, we'd have to actually, at this stage, our protocol is if anyone comes down with any of those symptoms, including a cold, we actually have to evacuate. Hopefully that can change as time goes on. And then I think there's the rest of the world of what you guys are trying to figure out here. One thing that I would refer back to is just if you're working with those schools groups, find out what school is currently doing if they've got to remove the student from the school. Typically it's probably that they're masked up and taken to the front office, and then a parent would probably come in, I would imagine, and then take them off for testing. But that's what we're having to do is sort of isolate, mask up, get back to the known point and actually transport them, or actually if they've taken their own transport, we actually get them to drive themselves. But we're at the point, the only way I could get my risk assessment through at TAFE, and I'm telling you just because of the bureaucratic system within governments, is that worst case scenario, I'll have to call an ambulance to get a student removed from the field at the moment. And I know that that sounds absolutely ridiculous, but it's the only way I can operate at the moment with adults. Hopefully that's going to lessen and change with some different protocols.
Speaking on the triggers perspective, so what, when we're actually flicking that switch and deciding on we need to initiate an action plan, you can't, as a member of the public, just rock up to the hospital and admit yourself into the emergency department. That's not something that's possible at the moment. You have to actually go through a triage system. So call the COVID hotline or call your GP prior to actually rocking up and deciding that you're tested. So in regards to figuring out those triggers, there's going to be that there's already the system in place to triage that. So if you've got several symptoms, a patient or a participant's experiencing several symptoms, you can just call that hotline, and that probably should be one step in triage before you start initiating that evacuation, if that makes sense.
Yeah, absolutely, Jacob. what we should be doing. The complication comes in when it's not an ambulance responding to, say, an office and saying, yeah, we'll take it from here. But if we're operating in a bushland environment, keeping that timely to for the patient and practical for the ambulance responders. So it may be, as Simone said, getting a student back to a point and then on. So I'm actually most interested in between where the client, the patient is, and how we can get them into that next step, which is the COVID screening clinic or the GP for that test. But looking after a staff member and the patient in a clean vehicle, what are we willing to accept there? So that's where I'm being very specific at the moment. Simone, I'll be in contact about your protocols as well. That'd be good to see and hear.
Sorry guys, I've got to head off. Hopefully I can listen to the rest of the recording, but maybe I suggest that we come back and do a second stage of this if people have found it valuable. Just to hear people's opinions has been really valuable for me. Yeah, so take care, and hopefully I'll see you back in this space.
Thanks, Simone. You may go.
I'd like to move to tourist and other types of groups. I put a post up today where, what are the issues where more than one operator or led group is trying to use a site or using a site or sharing facilities. So, it might be, let's say, something simple. It's an abseil site or a canoe area, and you then have a problem with one group. It runs over into all the other groups. Is that something where land managers need to be looking at booking systems? So that we can manage ourselves much better as an industry. Perhaps we should be doing that just from a quality point of view in many ways.
Yes, David, that runs into the New South Wales Parks and Wildlife Service, having split, put in a new system for bookings, split it down to 50% of capacity at sites, but also that you must register. I was at a cafe at the weekend, and in order to sit down, I noticed that you had to log in with a QR code or sign a paper register. So in order to get their COVID safe plans approved, people are having to keep those records. That's harder to do at, say, a public boat ramp or the public toilets at Kangaroo River, at a canoe put-in, that sort of thing. So some of those facilities remain closed until that can be done. But yeah, we could actually see a sign in to go to the toilet at a National Parks toilet, I guess. We'll see how that plays out.
Interestingly, Dave Chitty's point often happens in the Himalayas where, for example, there might be an army climbing team and another foreign team or whatever is going to climb in the same area, and they happen to know that the army team will have a doctor and other resources with them. And before you know it, whenever they've got a drama, they're imposing themselves on the army team. But back to the tourism here in Australia, I think it's a case of if you don't know another group is going to be there at the same time, when they are there, it's a bit like stopping everything until you work out amongst yourself who's taking responsibility for what, and maybe even documenting it somehow so that there's no doubt about who does rescues or who does whatever the activity happens to be. They're just some thoughts from me, because otherwise when things go wrong, it can be a bit of a muddle if those things haven't been sorted out before the start of the activity or activities.
Yeah, Patrick, and that could just be understanding who's going to use. Say, if you're using a climbing site at a public lookout, understanding who's going to be using which tables, and who might actually have a table that they've got brought with them in the truck, and that's going to be easier than having two groups through or a bunch of people going through with Dettol wipes between that. So just understanding that flow, but that's usually taken care of in the flow and the conversations between operators that turn up at different areas and through the permit system as well.
Yeah. A key point, of course, is cooperation. And when you've got people who are pretty good, generally they will cooperate to solve those various issues.
Yeah, and look, cooperation is great. If in doubt, communicate. Ask the question, get the understanding. I feel like I'm being a stand-in Laurie, so I'm going to throw to someone else. There's someone, Helen, you're giggling. You can contribute.
Thanks. I'm just a bit good at listening. And I am a tourism operator, so it's great that you guys have brought this up. And I think it's going to have, you know, a big ongoing impact, as we're all aware. But I'm also aware of obviously putting things in place so that there are certain protocols for public areas, but also realising and recognising that the number of community transmissions is so low at the moment. And I know that it's not going to necessarily stay like that, but just the reality of life at the moment, and hopefully, you know, ongoing, that to overcomplicate and put too many procedures in place may kind of kill the experience for a lot of people.
Totally. Look, there's a level of personal responsibility to be taken in an outdoor adventure activity, in a scout camp, or walking into a restaurant. You know, before this, I'm pretty sure I had an assumption that people wash their hands before preparing food. I think that's reasonable, and I'm going to continue to have that assumption. But if in doubt, I'm going to ask the question, because not only do people have a personal responsibility, they've also got a responsibility to me, because, as mentioned earlier, we are sort of connected for the 2 weeks after we've parted company also. So, you know, being able to have that effective conversation and that mature conversation with someone, if it's a client, to say, hey, can we have this understanding? Puts them on the same page, and also gives them that level of reassurance from them that they're taking responsibility as well. Because there is a bit of a plaintive cry of, you know, if you're going to work, keep us safe. You know, prove to us that you're going to keep us safe. But also, there's got to be a level of personal responsibility, because everyone is a person and everyone is involved in this, and can help or can create a gap. So, yeah, my thoughts there.
Just might jump in there. Looks like Laurie's back. But just a question came up regarding sleeping in terms of an activity. Obviously, a lot of us are camping, and others have got sort of hardtop sites. So maybe a bit of discussion about those sorts of things. The obvious thing is to have students in their own tents, which brings about its own issues in terms of health and safety, particularly if carrying. Are students capable of carrying a tent each? Are we looking at sites? We're looking at sites that are more accessible, where we can take the tents in for the students and have them not carry those things. But perhaps a bit of discussion around that would be helpful as well.
One of the interesting things there is, although obviously with adults you've got to give them their own tent, we perhaps should be looking into the education with no social distancing required in schools, and looking at all the contact in the playground and that. Can students actually sleep in the same tent? Can you put two people in a tent? It might be a question we need to be looking at. Yeah.
Sorry, go for it.
Sorry, definitely one that I think there's a range of different answers. I mean, I've been speaking to people who are using the boarding house 25% capacity. I've got people who are using 4 square metre rule. I've got people who are saying, you know, students don't need to distance, therefore they can lick each other's ears. All sorts of different answers to sleeping arrangements. I think even one organisation is looking at putting petitions into their tents to try and distance. So yeah, definitely a lot of different answers, and I think a lot of different time frames. A lot of people sort of saying, oh yeah, by the time we go to get back to camp, everything will be on, and therefore we don't really need to worry about that sleeping agreement. Whereas others are saying, no, we want to try and get back to camp right now. So what do we need to do to comply to sort of the arrangements as they are right now, and perhaps be proactive in terms of introducing something that will allow them to get back to camp earlier.
Rocky, I'm looking at, you know, we've measured out our bivvy shelters. We're not using tents as a go back option because we feel that they're enclosed spaces. Bivvies give us a better option and are 11.3 square meters, meaning a head to toe student pair who are also part of the same food group. So you're cooking with an issued transient. If schools want to have a food group which is 4 people, then those 4 people can share and carry equipment, and those 4 people are also 2 different sets of bivvy buddies. That starts compartmentalising things while allowing carriage of equipment and the same sort of experiences. But we're able to look at that because a bivvy is considered almost open, not a closed tent. So
Right, what's the difference in size? Sorry, what did you say?
For a tent, you're probably looking at 2 meters by 2 meters, or 3 meters by 2 meters, which is going to be. I was going off 2 meters by 3 meters. So a small tent enclosed though is 6 meters.
Yep.
Whereas a bivvy allows entry, you know, sleeping bags to be end to end, so heads at different ends of a tent, and you're not recycling the same air. That's flow through air, so it's considered fairly open, meaning that you're not in an enclosed space with them for 15 minutes, and you're not in face-to-face contact with them for 15 minutes or 2 hours, despite the fact you're sleeping under the same sort of 12 square metre shelter for 8 hours. So that's an option we're looking at, and within the D&E category, where we're actually also saying, look, actually, you're planning it, you're leading it, you're carrying it, bring a small tent. For that reason, because it's D&E and because it's not within a school group which is already mixing, we wanted to make sure that we're actually compartmentalising individuals more, whereas within a school group, those 4 people are actually probably already mixing, and will go back to that school community. They were my thoughts on what I'm trying to work ahead around accommodation. Hard top, we've also got in place that the hard top accommodation is cleaned before use within 48 hours to a commercial standard, and not entered until the designated tenants, if you like, are in there.
I just flicked that link in. I can't remember who gave it to us last Friday at the forum, but someone gave us the QCCC procedures that they're putting in place.
Just on that as well, I think from my perspective, we're keen to have still 3 kids in a tent as soon as we possibly can, because that's part of the reason why they're out there. That's part of the learning. And again, it's balancing that risk. What are we comfortable with in terms of risk? And that's possibly, it's going to be vastly different from school to school. But again, that's a low risk from my point of view, but also we'll be taking extra tents just in case we do need to isolate students. So we are balancing those 2 things out in our considerations. And last week of August is when we're going out on our first camps. Actually, we have 3 years going out all at once. So interesting to see what happens.
And I think on with that, thinking about the reality of what's going on, what's happening in schools at the moment, and the social distancing that's able to happen there, in terms of all schools are back and students are still in the same size classrooms, and to, you know, the reality of that's going on day in, day out, and then, you know, thinking of massively changing procedures outdoors to, how do I say this clearly? Yeah, sorry, I'm just trying to form my thoughts, and I think I'm better to write it down than complete sentences.
I would suggest that education departments, when they allow outdoor ed to go out into the bush with tents and students to go to camps, the departments themselves, I would imagine, would come up with what they will accept, and then schools might add something, private schools and others different slightly. But I would imagine we'll get directions from those areas before they're actually allowed to come into the field anyway.
Yeah, but I guess we've also got to be, like, they're dealing with a lot of stuff, and we know that they want to take something and go, oh yeah, that's good, we'll do that. So that's where we're trying to generate, hey, look at what we've done, which you can say yes to. Yes, we will accept that you will then put your name and paw prints all over it and claim it, and you will allow us to go ahead with it. But of course, they're not making any losses at the moment. They're just keeping on and teaching kids. We're trying to get back into their world.
And the other thing too, I think it's been mentioned, Troy, already, is the perception. It's important. I've got no doubt that anything we do as companies will be far above the playground and what's happening in school. There's absolutely no doubt about that. But the perception of being on a camp, or, you know, spitting in the same sink to clean your teeth, or sleeping in the same tent, those perceptions are things that we need to sort of combat as well, and that's the important part of that.
Absolutely, Ian, and that perception has vast money-making organisations raking in bunches of dollars for large school programs. Different perception.
I think on the perception side of things too, you know, I've always noticed over the years that you can have accidents on the roads, or accidents in schools or businesses generally, and everyone goes, oh yes, that happens. The second something happens in the outdoors, even though it's a very rare incident, it actually becomes quite a major thing in the media and everything else. Yeah, someone injuring themselves on a hike. Why were they there in the first place? I think we're better at that now, with people realising the bush is important, but we still get over nailed on something. So we do need to make sure we're on top of it.
Yeah, I certainly agree, and I think with what Rocky was saying earlier on about, if God forbid something were to happen around a COVID case in an outdoor education setting, that we're all going to suffer from this. If we take this and take actions early on, we can always look at what management did and didn't work, where if we just go with business as usual before this, there's no, we can't take that back. We'll never go back again. So it's best to sort of forward lead in those things.
For other instances, companies might already have a media template or media plan, or a designated media person who may have been exposed to training around, if they've got to say something to the media, this would be a good template to say it. That might actually be something which it may be useful to have as a peak body available to our members, so that our members, should something happen, whether they're in a community, they're operating in a community where something has happened, another cluster at a caravan park or something, or you know, more disturbingly in their own company, that that they've already got some resources to draw on, rather than just being the focus of a media frenzy, having that structured information. Usually that's an individual company decision to do, but it may be something we might be able to to create a resource for, so that we can have a bit of a first line of defence or message in case someone does have that occur.
I think that's valid, really valid, Troy. That's probably one of the keys, and the fact that we've got state bodies that can actually be involved in some of those processes on that back end of a critical incident, which is essentially what this would be, are really, really critical, I think, in terms of making sure that things are kept in perspective if something does happen.
Andrew and Laurie, I'm not asking that the state peak body would be speaking for someone or defending someone, but rather that it's just a structured document so that someone can be resourced for what they should and shouldn't be saying. Because a small operator has gone through a lot of effort in getting all their paperwork in order and having all that, isn't necessarily the same person who can point to that and message effectively to the media that, no, we've done all these right things. That doesn't come until 3 days of media outrage has subsided.
That probably is something, Laurie, that the Outdoor Council of Australia might have to take on board, so that we've got the same story across the whole country now that we're heading.
Yeah.
national.
Yeah, absolutely. I think the intricacies of the differences between the states is problematic in a lot of different aspects. But yeah, Andrew, Dom, I'll be calling Dom later.
I'll just throw some things in. I'm currently writing a crisis management plan for Tourism Northeast, and it covers issues exactly what we're talking about, from a major issue. What is the message that's meant to go out and who actually carries that out? And I would suggest that, well, I know from the work I've done on bushfires this year, the amount of businesses that are out there that do not have the policies and procedures in place to deal with anything like an emergency. They sit and we think that we do, but when you actually work through the process of all of the things that need to take place, do we have the capacity to be able to deal with this? And that's where the organisations, the peak bodies, need to put in place the process that allows each small individual business to be able to tap in to that expertise that is already there and can deal with it. How many of us, even on this hookup, have had media training? How do we deal with the media? Yeah, there's probably 3 or 4 of us, but not many. And if they want a negative outcome from whatever it is that the crisis is, they'll work at it. They won't just take my opinion. They'll want to ring and talk to everyone till they get the answer that they want. So I think that concept is a really strong one.
That's it, and a lot of it is about not about what you do say, but rather what you don't say, and how you funnel that message to one spokesperson. You certainly with the new crisis management plan, you know the people, you've got the contacts, all of that. You can make that happen, but all media wants to do is turn up and give a great shot and a sense of outrage. Then funneling a really dry message can be your most effective defence against that for the first day, and then being able to get out that other information and communicate that well. But there's structures and methods to that, so it'd be great to be able to make those available in some sort of, even just a worksheet form for operators during this period.
Actually, that might be a worthwhile conversation also to have with schools, is just that you have a plan in place and just discussing that, because that's part of the assessment that I'm asked to do, is do we have contingency plans? Do we have and it might end up with a critical incident team where we'll have to message. And I know private schools are big on their reputational risks. And at the end of the day, there's probably going to be minimal actual damage to a person. unless you're rather old or suffering other conditions. But that's that reputational damage. But if providers could give that, and if my outdoor ed provider was able to give a clear list of, okay, here's our process and protocols, here's our response plan, and get everyone on the page, I think that would make our executive feel more comfortable too. So I think that's a fantastic idea, to have something that's consistent for everyone.
And look, to give a nod back to something which has already been done, certainly the Outdoors Council of Australia and New South Wales, Outdoors New South Wales COVID Safe Plan template and framework is really those things that we're pointing back to. So having those in place, but also being able to message out as an organisation, or give support for that as a peak body. That those things are in place, that have been in place for this time, and look at that, things are actually happening as they're meant